Okay, conditions. Boy, between testing and conditions, and again, I brought up WebMD. Here I was doing the best I could, Googling and trying to figure out what conditions or what was going on, right? And I got a laundry list, 2 pages long, from very terminal, very very aggressive, and like worst case scenario to, oh, it could just be you have allergies, right, and everything in between. Boy, like as a patient, I don't know what to do with that, right? Like I don't know where to start. Like general practitioner, my doctor, okay, let's see what they say. And then they're like, well, I'm not sure. Like I've got a current practitioner. She's amazing, very, very intelligent person, but vestibular issues aren't her wheelhouse. I mean, there's just no fault in that. It's okay. And she's been clear about it. But she's also supportive in me going and finding that specialist. Some practitioners aren't that nice, right? They're like, take a beta histamine, take some Flonase, or take some Claritin, and be on your way, and I'm sure it'll be fine. Sorry, right? How do I approach it? And the conditions for you specifically here, you talked about a couple. Rehabilitation center. And you also mentioned vertigo and dizziness as a symptom necessarily. It's not really the condition. Do you see a lot of people come back with other conditions and then you find it? Do you see them as vertigo specific, or what do you see from a condition side? From you specifically there.
Well, we're a large tertiary medical center with 3 departments that see a lot of dizziness and balance patients. So I think Johns Hopkins sees somewhere around 3,500, 3,800 dizzy patients per year. That's a lot.
Wow. That is a lot.
Between PT, ENT, and neurology. So we see a lot of your similar type of situation, right? I've seen XYZ, I've seen this provider, that provider. I still don't have a clear understanding as to why I feel the way that I feel. So we see a lot of the chronic, complex, multifactorial dizziness where maybe there's a migraine component. They've probably at some point morphed into this PPPD, or persistent postural perceptual dizziness realm. We see patients who do have BPPV. So we see a good mix, but we do get a decent amount of the chronic side of the dizziness thing. For patients who are entering this journey, right, the 2 most common conditions that cause episodic dizziness or vertigo are BPPV and vestibular migraine. And depending on which prevalence studies that you look at, vestibular migraine is sometimes just slightly above BPPV, and sometimes BPPV is just above vestibular migraine. But those are the 2 most common things that cause episodic dizziness. So those should be at the forefront of people's mind. And vestibular migraine is hard because people are like, well, I don't have a headache. And that's probably an episode all in of itself as to how to go about the vestibular migraine piece of things. But those are the 2 most common ones.